Dementia is a complex and often misunderstood condition. Here are 5 things to know about dementia. 1. Dementia is not a natural part of aging. You may forget a name or a face sometimes, especially when you are older, but dementia is something different and it doesn't just affect older people. Over 40,000 people under the age of 65 in the UK have dementia. This is called early onset dementia. 2. Dementia is caused by diseases of the brain. There are 5 main different types of dementia that damage different parts of the brain. Alzheimer's disease. This causes nerve cells to die, which results in the damaging of the structure and chemistry of our brain. Vascular dementia. This is caused by problems with blood supply to the brain. Mixed dementia. This is when you have a mix of both vascular dementia and Alzheimer's disease. Dementia with Lewy bodies. Frontotemporal dementia, also known as Pick's disease. 3. Dementia is not just about losing your memory. When most people hear the word dementia, they think of memory loss, and it does often start by affecting the short-term memory. But it also affects the way people think, speak, perceive things, feel and behave. Other common symptoms include difficulties in concentrating, problems planning and thinking things through, struggling with familiar daily tasks like following a recipe or using a bank card, issues with language and communication, for example keeping up with a conversation, mood changes and difficulties in controlling emotions. 4. People can still live well with dementia. Although there is no cure for dementia currently, scientists and researchers are working hard to find one. But support and treatments are available to help manage your symptoms and day-to-day life. This can allow people with dementia to lead active and purposeful lives. 5. Dementia affects people in different ways. Symptoms of dementia get worse over time, and how quickly this happens varies from person to person. Some people can stay independent for years before needing daily support. I hope you found the information in this video useful.
Alzheimer's disease is a condition that affects millions of people worldwide. It is the most common form of dementia. It's a progressive neurological disorder that impacts memory, thinking, and behavior, making daily life increasingly challenging for those affected. What are the symptoms of Alzheimer's disease? The symptoms of Alzheimer's can vary, but they typically begin with mild forgetfulness or struggling to recall recent events. As the disease progresses, individuals may experience difficulty completing familiar tasks, problems with language, such as forgetting common words, disorientation, including getting lost in familiar places, mood changes, like depression or irritability, and in later stages, they may struggle with basic self-care and recognize close family members. What causes Alzheimer's disease? The exact cause of Alzheimer's is not fully understood, but scientists believe it involves a combination of genetic, environmental, and lifestyle factors. At the core of the disease are abnormal protein buildups in the brain known as amyloid plaques and tau tangles, which interfere with brain cell function and lead to cell death. Risk factors include advancing age, family history of Alzheimer's, certain genetic mutations, poor cardiovascular health, like high blood pressure or diabetes. Can Alzheimer's be prevented? While there's no guaranteed way to prevent Alzheimer's, research suggests that a healthy lifestyle can reduce the risk or delay its onset. Here are some recommendations. Stay physically active with regular exercise. Engage your brain through reading, puzzles, or learning new skills. Maintain a heart-healthy diet, such as the Mediterranean diet. Prioritize quality sleep, as poor sleep has been linked to cognitive decline. Manage stress through mindfulness or relaxation techniques. Stay socially connected to combat isolation. What treatments are available? While there's currently no cure for Alzheimer's, treatments can help manage symptoms and improve quality of life. Medications like cholinesterase inhibitors or memantine can temporarily improve or slow the progression of symptoms. Non-medical therapies are equally important, including cognitive behavioral therapy to address mood changes, music or art therapy to stimulate the mind, structured routines to reduce confusion and anxiety. Caring for someone with Alzheimer's can be overwhelming, but support is available. Reach out to healthcare professionals, support groups, and community resources to navigate this journey together. Remember, early detection and proactive care can make a meaningful difference. Thank you for watching, and we hope you found the information in this video useful.
Our brain is one of the most important organs in our body, and keeping it healthy and optimized is really important for our well-being. Let's look at how our brain ages. Gestation. In gestation, 250,000 neurons are created each minute whilst we are still in the womb. In childhood, our brain produces twice the neurons it needs, but keeps only those used. The brain is at 95% adult weight by the time we are age 6. In adolescence, our brain is now fully grown, but the wiring is still developing and not yet complete. In adulthood, our brain power peaks at around age 22 and lasts for about 5 years and then declines. By age 45 to 49, a 3.6% loss occurs in memory, reasoning, and comprehension. In old age, there is a steady loss of brain cells and the decaying of neuron denticles. By age 80, our brain shrinkage worsens and cognitive abilities decline. We hope you found the information in this video useful.